without dialysis, a lot of this wouldn't be possible. I'm very grateful that we have dialysis for ESRD patients because unlike, say, liver failure or heart failure, where there's no liver dialysis or heart dialysis, there's no backup. This is it. You die if you don't have dialysis. So dialysis, first and foremost, is a way to keep our patients going when there's no other option. So once you have a modality like dialysis, it then allows you to think of other things, other alternatives to it, if you will. So this is an age-old question, dialysis versus transplant, which is better? At the end of the day, there are a few facts. One, it's definitely an individual and a personal decision, but it's a personal decision that the patients make after they come and see us in evaluation clinic and we share the facts with them. And the facts really are, one, for the patients at large, dialysis versus transplant. Transplant is not just improvement in quality of life. If you consider being on a machine 3 times a week or being home at night on a peritoneal dialysis, not quality of life. That's a personal decision again, a definition again. But dialysis compared to transplant, transplant offers not just quality of life, but it's actually life-giving. So for every age group, starting from the pediatric age group to 70-year-olds or even higher, the expected life expectancy with transplant is far higher than with dialysis. It makes sense that the younger you are, the more life expectancy you have, and so you're going to have more life years gained because of transplant. And the older you are, your life expectancy is lower, and so the life years gained may not be as much. But even in that category, transplant compatible dialysis is life-giving for the general population. So because of that, if you have this modality that actually makes you live longer, and interestingly, when you think about a patient with malignancy or cancer who's getting chemotherapy and a 25% survival may translate into like a year or 2 more of their life, we're talking about 10, 20, 30 years of life for some patient population. How then, when you have a modality like this available, can you not offer it to your patients?